Dr. Boris Ratiner is a practicing rheumatologist in Los Angeles and is board certified in internal medicine and rheumatology. He joins us now. Dr. Ratiner, thanks for taking a few minutes to talk with us on rheumatoid arthritis, and we welcome you to Healthcass.
Thank you for having me.
Can you share your thoughts with us as to the prevalence of RA in the Los Angeles area and how that may compare to what we see nationally?
I think that the prevalence of rheumatoid in Los Angeles is approximately the same as it is nationwide, which is about 1% of the population. I think we certainly see a lot of rheumatoid arthritis, but more and more we're seeing less severe disease because it's being picked up earlier by the primary care doctors and referred to us earlier on.
And in terms of subpopulations within your practice, do you see any differences relating to gender or ethnicity?
It's more common in women, and there's several peaks. One is in the 20s. Those tend to be the most severe, then one in the 40s.
And compared to when you started in practice, what changes in patient outcomes have you seen with your patients, especially since the introduction of biologics in 1998?
Clearly, we've seen a huge change. Once we get these patients early in the disease, they often almost always do well. Biologics as well as the non-biologics like methotrexate have made a tremendous difference in both how we treat and diagnose these patients.
And you talk about patients doing well due to biologic therapy. What is the goal of treatment for patients with RA? We've heard a push towards treat to target and setting realistic goals with your patients, and remission is often discussed.
We do get remission in many cases if they're found early on, but the remission is more likely drug-induced, and once you stop the medications, often, eventually, the rheumatoid arthritis will flare back up.
What's your advice to primary care physicians when they are trying to assess or manage a patient with RA? Is there a specific diagnostic technique or test that you may be able to suggest?
I think that if a patient is having bilateral, which means on both sides, joint pain, especially in the hands and the knees and the feet and the shoulders, and is having also morning stiffness, then that patient should be considered as having possible inflammatory arthritis like rheumatoid and should be evaluated with some blood work and possibly by a rheumatologist.
And besides the challenge of getting RA diagnosed early and getting the patients referred to a specialist, what other challenges do you encounter? Cost, compliance, access, other issues?
The answer is yes to all of them. Access is a problem, especially in patients who have HMO-type insurance or in patients who have Medi-Cal or no insurance. Because I don't see those patients, I don't see that as much, but I know that is an issue. Compliance with medication is a common problem because all of these medicines have some side effects, and there is a challenge getting some of these medications for patients because they can be quite expensive. The anti-TNF inhibitors or the biologic agents tend to run about $1,800 a month, and sometimes insurance companies make patients pay a large copay, and that can be very difficult. But they all have special programs, and these programs can help almost every patient.
And as the treatments continue to evolve for RA, what do you hope to see in the next 5 years?
I think we're going to start seeing some oral medications called JAK2 inhibitors, which are going to be available very soon. And these are oral medications which are as effective as the biologic injectables. And I think we'll start seeing some of those medications coming onto market. There's another pathway called the anti-SYK, SYC pathway, and that also will be oral medications. And I think that we'll start seeing a conversion from a lot of patients being on the injectables to some of these oral medications.
Well, Dr. Ratiner, it's been a pleasure, and we thank you very much for joining us today on Healthcast. We look forward to circling back with you and speaking with you again in the coming months.
Thank you so much.
That was Dr. Boris Ratiner, practicing rheumatologist in Los Angeles, California. From our Healthcast studios in New York, I'm Peter Hurwitz. Good day.